So you may be thinking, I'm eligible for Medicare, but when do I enroll? While I'm working or after I'm working? And then how many days prior to retiring or how many days after should I enroll into Medicare? This, along with many other questions I'm going to be answering on these next video series. Stick around, I'll be back in just a minute. Hey everyone, my name is Kelby Houghton. I'm the CEO of MedicareHub, and we're going to be diving into, who is eligible for Medicare and when do you enroll? Do you enroll while you're working or after you're working? How many days prior to working do you enroll into Medicare? And then how many days after do you really have before it starts penalizing you for not having what they call credible coverage for Medicare? We're going to be covering all that today. So who is eligible for Medicare and when should you enroll? What does this really mean for you, and then how to understand it? So who's eligible that's under 65 years of age? So you maybe have been working and then qualified for Social Security disability insurance. Now, typically, if you qualify for this, you normally have had to hire an attorney, go to court, and the judge usually will slam the gavel on your case, deeming you disabled. A lot of times people qualify for SSI, Social Security insurance, but not SSDI. So when you qualify for SSDI, which is one of the first things you see here, in the 25th month, you're going to go on Medicare Part A and Part B automatically. So if you've been working, injured at a job, and you're going to qualify for SSDI, I would encourage you guys, if you're looking at information and trying to understand that process, to get with a licensed agent, because there's a lot of moving parts to when you qualify and what health plan options, and most people are confused about it and just go on original Medicare, and then they're exposed with a lot of out-of-pocket costs because you're going to have medical costs associated with your disability, and it's important to understand what your options are. The second one is if you're a railroad retiree disability, also after 24 months. So just like Medicare and then the railroad, if you work for the railroad department and you've qualified for disability for some reason, you were injured at a job or injured on the job, and then you qualified for disability, after 24 months, you're going to go on Medicare Part A and Part B. Those disabled for Lou Gehrig's disease. So if you've qualified or have been diagnosed with Lou Gehrig's disease, you're going to qualify for Medicare Part A and Part B immediately and go on to Part A and Part B, and then be eligible to enroll into a Medicare health plan. So that's the key. When you have A and B, it's kind of the key that unlocks the door that allows you to enroll into a Medicare health plan to lower your risk and also provide you prescription drug coverage. So you need to be aware of that. Individuals with end-stage renal disease, so ESRD. So if you've ever been diagnosed and you have end-stage renal disease and you've been diagnosed for that, well, Medicare is going to put you on Part A and Part B. The coverage for end-stage renal disease is, well, the service and just to cover the type of medical situation you're going to be in to get dialysis and all the different things for the ESRD is extremely expensive. So going on Medicare is obviously a big, huge step and a help, but you also want to enroll into a Medicare health plan and then understanding the different health plan options. But you're going to qualify if you do have end-stage renal disease. You're going to go on to Medicare Part A and Part B immediately. We often hear Medicare is extremely confusing. It's complicated to navigate the different options of Medicare health plans, when to enroll, when not to enroll, the penalties, and all the different questions that go along with prescription drugs, the different health plan options, whether it's Medicare Advantage, Medicare Supplement, do I stay on original Medicare? All these complicated questions can be answered by registering for our Medicare Made Simple workshop. We want to provide you a free copy of this workshop because it allows you to walk through all of those questions and have answers to those questions, along with providing you a guidebook to follow along with each video series that we provide you. If you click below, you're going to be able to register. Guys, my name is Kelby Houghton. I'm the CEO of MedicareHub, and I'll be guiding you through the Medicare Made Simple workshop. Click register and we'll send you a copy today. When can an employee sign up for Medicare? So you really have three general time periods. You have your initial election period, which you're going to talk about, your general enrollment period, and then you're going to have special enrollment periods, which is very important for you guys that are coming off an employer-based plan. Maybe you're 68 years of age. I use 68 as a kind of a caveat age because a lot of our clients, a lot of times, are 68 or 70 years of age and they're retiring and they're trying to figure out, what do I do? What do I qualify for? And they don't understand the special election period. We're going to talk about that during this video series. So your initial enrollment period, this is very important and very simple to understand. If you take your birth date month at 65 years of age, and let's say it's August, then you're gonna have May, June, July, August, and then September, October, November, this 7-month window. So you're gonna have 3 months before, 3 months after in your birth date month. And we call this the initial enrollment period. It's a 7-month window that allows you to enroll into a Medicare health plan, but also if you're coming into this, you're on an employer-based plan, you're gonna be retiring coming off of that. I always say use this first 3 months or 100 days prior to enroll into your Medicare Part A and Part B and be eligible to sign up on your birth date month. So if you're gonna be retiring before or at 65 years of age, a lot of you guys need to understand that the basic of Medicare starts, Part A and Part B becomes eligible for all Medicare beneficiaries that turn 65 years of age. So if you're working, it changes the scenario. If you're not working and you qualify for Part A and Part B, you're not gonna be drawing your Social Security. This is huge because you have to sign up. You have to do paperwork to sign up for Medicare Part A and Part B if you're not drawing your Social Security. If you're gonna draw your Social Security, you're gonna be getting some documentation in the mail. You're gonna get your Medicare red, white, and blue card about 100 days prior to your birth date month. So this is very important to understand. 3 months prior to the birth date month, and 3 months after the birth date month. And your effective date for coverage will depend when enrollment occurs. So if you enroll 3 months prior, it'll occur on your 65th birthday month on the first day of the month. Now for you guys that are special and you have the 1st as your birth date, let's say August the 1st, your Part A and Part B actually starts the prior month on July 1st. So that's just a rule that's in place with Medicare. It's important to know for you guys that are watching that does have a birthday that falls on the 1st. It's like 1 in a million people that have that happen. But if you're one of those people, you need to understand it's the prior month on the 1st that your Part A and Part B is going to start. So what is the general enrollment periods? Well, the general enrollment period is basically this time frame when you qualified to enroll into Medicare, and that would have been going into your 65th birthday, or you came off an employer-based plan and for some reason you just didn't make a step into enrolling into Medicare and you're having to enroll into Medicare for the first time. You would be doing this from January the 1st until March the 31st. Now, a few years ago, they used to make you wait until July 1st for your Medicare Part A and Part B to start. That has gone away. That rule about a year ago has changed. We're in year 2024 right now. About a year prior, they made new legislation, and this allows you to enroll January during that month, and your coverage is going to start February the 1st. So it just goes each month thereafter. So if you do it in March, it's going to start April the 1st. So for those that don't enroll during their initial election period or don't qualify for one of the special election periods I'm getting ready to cover with you in just a second, you're going to have to enroll into your Medicare Part A and Part B during the general election period. Now, the problem with that is you're going to incur a 10% penalty on the premium, the Part B premium, for every 12-month cycle that you did not have Medicare Part B or Part A and Part B if you didn't sign up for either or. You're going to pay a Part B premium. They're going to charge you, the government's going to charge you. So this is not us charging you. It's not the healthcare company charging you. It is Uncle Sam charging you a penalty for not enrolling in the proper time. You may not have understood. You may have turned it down. You may have been told misguided information. You may have had an HR person tell you something different. It doesn't really matter. It falls back on the responsibility of the person, and you will be assessed a penalty. This is waived when Part B is delayed by an employer plan, which we're going to talk about here in just a few minutes. So that's going to be important to cover that. Stick around. I'll be back in just a minute and go over a little bit more information about important things when it comes to the general enrollment penalty and how that works. Hey everyone, in this next video you're going to be watching, I'm going to be covering how the general enrollment period penalty works and how it applies to you if you didn't sign up for Medicare appropriately or at the right time. Stick around. I'll be back in just a second on our next video and explain how this penalty works and how it's going to apply to you.